Hello, Dr. John Epling here with our next QI talk called Problem Analysis. Why do we do problem analysis? One, consider the step just before this was creating a flow chart of the process you're working on. So you've already decided on a topic that you want to improve, and you've created a flow chart of the actual process, and so you want to see where the variation is. We look for how that process varies when we do it. And you might say, well, we have a process, why would it vary? Well, because we are made of teams of humans in medical practice, and so we need to consider that there's bound to be variation in whatever we do. The key is we want to reduce unnecessary or unwanted variation that could lead to bad outcomes. That's what we're really after. A certain amount of variation is okay if it doesn't get us off track. We want to reduce unnecessary and unwanted variation. So our goal in this problem analysis step is to find a specific part of the process that varies and target our PDSA cycles and our interventions to reducing that variation. So here's a very simple example. We'll take ordering a basic metabolic panel for patients that are on high-risk medications. So in this overly simplified flow chart here, the patient may call for a refill. I'm going to pull up the pointer here. May call for a refill. The nurse pulls up the refill smart text that they have in the electronic health record, sends the message to the provider checks for when the last basic metabolic panel was done. Maybe if that date was less than 6 months, the provider would be fine to order a refill. If the date, however, was more than 6 months, the provider would order a lab and have the patient either make an appointment for the lab or to come in and be seen. So that's a basic sort of flow chart for the process that's focused on this outcome. Now, where could the variation occur? Well, we can think of a number of things right off the top, right? The nurse could pull the wrong smart text, just they were given the wrong information on training, or it's been upgraded since then and they didn't catch it, whatever. The provider could look at a different refill protocol rather than the smart text one, so standardizing the overall process might help. The smart text may not work well, may not pull in the correct lab values. The patient isn't, for some reason, told about the need to go to the lab. The message didn't ultimately get to the patient. So right offhand, we can think of a number of ways that this very simple process can vary. The trick is to be systematic about looking for variation. We don't want to just guess off the top of our heads. We want to be a little bit more systematic. So how would we do that? Well, one method for problem analysis is called the 5 whys. And in this example, you're really channeling your inner toddler by asking why repeatedly, as toddlers do. So in this case, you ask why about a particular variation in the process until you get to what's called the root cause, the basic problem that causes this cascade of variation that we see. The point is to try to fix the root causes rather than applying band-aids to one of the more superficial causes. You want to get to the real reason why a process is varying like this. So in our previous example, we might ask, well, if the patient didn't get the message about going to the lab, why is that? Well, are the nurses forgetting to tell them? Why is that? Well, they didn't see the message clearly. Why don't they see the message clearly? Because it's buried in several layers of text in the EHR message. If you keep asking why about elements of variation, you can get to the root cause. The next method to cover would be the fishbone or the Ishikawa diagram. These are pretty popular ways to look at process variation. And in this case, what you would do, if you look at the example, the outcome is a low rate of Pap smears, and we might postulate that there's several big reasons why that happens. There might be a problem with the procedures, there might be a problem with the environment, there might be a problem with the people and the equipment. So you have those basic categories, and then you dive down into specific characteristics of each of those categories. So in the people category, there are staff and patients involved. In the staff category, there may be competing priorities, they may not be aware of problems with Pap smears, etc. So you can see how in each of these ways you can sort of drill down on potential causes and potential things to fix in your PDSA cycles. The next method is called swim lane diagram. So this is a very patient or customer focused method for analyzing a process. It emphasizes both handoffs between people, which is something we do in healthcare all the time, but also gives you a sense for how much patients travel back and forth in a given process. So if people are coming if they're making unnecessary steps, you can see that pretty clearly in the swim lane diagram. So on the example here that's provided, the patient signs in, then the next swim lane is what the front office staff do. They check in the patient, then the patient has to do something. Then the responsibility gets transferred to the MA for a series of steps, and then the physician sees the patient. So you can look at this process and ask, well, why does the MA having to do 3 things? Why does the patient get checked in and then immediately go back to the MA? You can look at the process for all those different variations. And then the final method is something from a field called human performance technology. It's basically looking at a performance problem and deciding where sort of broadening the scope for where the problems might occur. Unfortunately, I think in a lot of QI work and even in a lot of research, we assume that performance problems are due to lack of knowledge or lack of training, and that is most often not the case. We tend to default for that, thinking that a CME session or a quick in-service will solve the problem, and that's usually not the case. So in this case, what you can do is you need to consider all the different factors, and we give a grouping of motivation barriers, lack of organizational support, or improper organizational structure, as well as lack of training. Look at all those things and try to determine where the performance deficit is caused from. You may need to interview people involved in the process, or maybe survey if it's a bunch of people involved in the process, and get some idea of where the real problem is before selecting an intervention to improve it. With all these methods, teamwork is critical. You needed a team to be able to develop your flowchart because you have to understand how everybody experiences the process that you have. And in this case, with variation, it's even more important to involve the team because everybody's going to vary in their implementation of the process, and you need to understand the extent of that variation. You can't know where the variation is unless you ask all the people involved in the process. What's the output here of this step? Well, at the end of the problem analysis step, you should have a few ideas for places to target your PDSA cycles and select specific improvement interventions. Whether you're looking for the root causes or the things that are most likely in the categories that you've devised on the Ishikawa diagram or the swim lane diagram, find the specific points that you think you can change to reduce the unnecessary or unwanted variation. Now, as you make changes to your system and to your process, you may need to redo this whole problem analysis step just because you have a new system to work with, and you may need to catch any variation that pops up. It probably doesn't have to be as extensive as the first time you do it, but it's another thing to consider. Okay, that's problem analysis. Happy improvement.